Gout is an extremely painful swelling and inflammation of the joint. Usually it's the big toe or the joint just behind the big toe, which is the first metatarsophalangeal joint, technically speaking. And it is a result of the build-up of uric acid in the body, and we get a collection of crystals which form in the joint, and these cause very high levels of pain. So typically, gout is associated with men, so it's something like 9 or 10 times more men than women suffer from gout, and it is usually related to older people, older populations. So we typically see this in patients of the age of sort of 40, 50 and upwards, and it is most commonly associated with certain lifestyle choices and diet choices, but as with all things, it can obviously affect people in the absence of any of the above. Gout would be one of the few conditions that we generally really ask for patients to have a referral from their GP or from their consultant, certainly at least a letter just confirming the diagnosis. Although we are able to clinically diagnose and we can see the diagnosis of gout, if you like, on ultrasound, the treatment with an injection is really for pain relief, and it's really important that the patient has a formal diagnosis and is receiving the appropriate education and general treatment from the GP or rheumatologist. The treatment of gout will normally be via the GP, and they will give the patient medications which can treat the condition and also help prevent flare-ups of gout. And it's really important that the patient is actually accessing this treatment via the GP. Sometimes people will have flare-ups, and this is where ultrasound guided injection can be really useful as an adjunct to the general ongoing treatment that the patient's receiving.